Hi, I'm Ken Carter. I'm a psychiatrist, currently working within the VA system after many years in the private sector. Also a full-body acupuncturist, trained extensively in that modality as well. But where I got my start in medicine as a practitioner was actually halfway through medical school. Between the second and third years, the didactic and clinical years, when I took off a year to travel around the country in order to really investigate if holistic medicine, alternative medicine, such as acupuncture, was really effective in helping very sick people. I ended up spending half of that time in recovery center in the South Bronx. During that time at the Lincoln Acupuncture Recovery Center in the South Bronx, I was introduced before I became a physician, before I became a psychiatrist or an acupuncturist. I was working in a clinic that was dealing heavily with drug diversion work and establishing a model that was used across the country in terms of using ear acupuncture to assist with compliance with individuals who were caught between law enforcement and the local community, mental health, between the court system, and mental health. And I'd like to tell you the story about the first client that I ever treated, because I think it is very instructive. It was instructive to me then and has really been a touchstone for my professional and academic life going forward. I had gotten the individual training on how to provide the treatment. That took about a day or so. And the first patient I was introduced to was a schizophrenic patient who had been out smoking crack all night long. He comes in and he is in a state of agitation. He's anxious. He came in voluntarily. He looked distressed. His eyes were wide. He was moving around a lot. But the scariest thing for me was that I was told he was also having command auditory hallucinations, kill himself and other people. So here I am, green as they come, and I'm directed to him and told to put and told to treat him. Go to him. I treat him. In a half an hour, he wakes up. I'm sitting there, still staring at him, waiting for something untoward to happen after I've treated him in such a state. But when he awakens, a completely different person sitting in the chair in front of me. His face and demeanor are much calmer. He's able to hold a conversation without getting distracted and going off track in the conversation. But even more to the point, he was no longer having the auditory hallucinations telling him to kill other people or to kill himself. He was still having the auditory hallucinations, hearing voices, but they were greatly diminished and they weren't affecting his behavior in terms of paranoia. So his insight was a lot better. This was over the course of a half an hour. Again, I saw this as in my later training, I learned the words to put to what I. One of the things we know is that within the legal system, there are more mental health psychiatric patients than are formally enrolled in mental health treatment programs. That's been the case for a long time now. And often they are there in settings where resources are limited, where personnel are stretched, and even in terms of getting formal psychiatric care, psychiatrists that may be available to prescribe or therapists that are able to provide that sort of therapy. So it was very impressive that with a very simple modality that I had learned over a period of days, I was able to treat someone and get this sort of profound effect. So having this direct experience of my own, and then going into formal psychiatry training, I went into this already with an idea. There's something wonderful here that everybody should know about. I would like to tell this story. The slide you're looking at now represents what was one of the highlights of my professional career when I served as Director of Acupuncture and Treatment Services for the Drug Diversion Project with the Superior Court of Washington, D.C. It was a demonstration project in the auspices of NIH CSAT, the Center for Substance. The slide that you see there now references pages 102 to 104. I am a co-author of this and focus mainly on these several pages. But what it represents is the first time in the United States when alternative medicine was recognized as a best practice. This was in 2006, when NADA was well recognized as improving engagement and retention. And one of the things that we know in both mental health treatment and in substance use disorder as a subset of mental health treatment is who keeps coming back is the most thing that is predictive of who's going to get better. Engage. You see here is a logo for the National Acupuncture Detoxification Association. That is what NADA stands for. This is our logo. As you look at the logo, the way it impresses me, and the responses I often get is, wow, he looks relaxed. Wow, individual looks like they're asleep. And what's that? Sticking out of their ears. There are needles sticking out of their ears. Well, early on, the earliest days when Lincoln Detox was first starting its seminal program, there was the use of acupressure. There was the use of beads. The needles came along a bit further down the road, not far. And then we focused on needles quite a bit. But in the past several years, especially with the onset of COVID, the need for the social distancing, the limited access to mental health treatment that patients have had, we've really been encouraging for our programs, for providers, to help with their own stress during this time, as well as for patients. And what we have all learned is that the acupressure alone, for many clients, is just as good as the needles. Some say that the needles may have a somewhat more robust or stronger effect. However, many say that it's different, and that the beads seem to have a softer effect. So it can be a matter of preference. But the idea of NADA is that we really do not want the client to think that any improvement that they sense in terms of their well-being is coming from the provider. We want the provider to be NADA, to be as invisible as possible, because we want to give the message to the client from the inside out, from what they feel on the inside, in a way that cannot be expressed in words, that they have the capacity, the capacity to improve, the capacity to make good choices that can make the difference they feel. And so going back to the example I gave of the schizophrenic, the very first patient I ever treated who was also addicted to crack, came, even though that individual was not quite ready to enter full treatment yet, he was in harm reduction mode by his own choice. He would come when he felt he was getting too close to the edge and knowing that things might happen that would land him back in jail or perhaps even dead in terms of his pursuit of the drug. Later on, when he was more psychologically prepared, with the assistance of NADA, in addition to counseling services that were available there, using NADA as an adjunct with his psychological preparedness, he would eventually enter into treatment. It helped him to do better and to improve, of course, both within the legal system and for himself in terms of his primary psychiatric illness. and in his ability through the course of his work is a question that often comes. And I think the most honest answer is that there are many explanations they works. There's been a lot of bench primary research using acupuncture going as far back in the 60s. For over 100 years, it's used in animal horses and things of that nature, which really lies to rest the idea about whether or not placebo is a soul effect. One of the explanations that I tend to like the best is a simple one, and that's that nada treatments are like a glass of water to a thirsty person. I like to use that example because without water, no matter how much fertilizer you put on a plant, in a human being, that might be akin to prescribing antidepressants, anti-anxiolytics, antipsychotics. No matter how much water, no matter how much fertilizer you put on that plant, unless they also get water, their growth is not going to be optimal. As a matter of fact, without the use of water, and our providers and practitioners who also have an internal life, even those of us who work within the interface of law and mental health, we can get, quote, burned out too and need some water to help to that fire out, that fire of anxiety, of angst, sometimes of anger, sometimes of moral injury that fuels the sense of burnout and compassion fatigue. So I like to think most simply of the NADA protocol as a glass of water. And with that, the ear comes into play because within the ear, there's a representation of the entire biological, psychological, spiritual state of the individual can be represented within the ear itself in terms of the correspondences that exist. Of course, when I talk about the psychological and spiritual associations as a clinical and diagnostic tool within the ear, speaking mostly from the standpoint of an acupuncturist in traditional East Asian medicine. From a biomechanical perspective, which is what I'll focus on now, Western medicine neurologic perspective that I'll focus on now, I want to draw attention to the picture that we have here. There are 5 points that are traditionally used within the NADA, within the protocol. And what I will point out here, without going into too much detail about each point, I would just point out a very powerful observation that the lower half of the ear is stimulated entirely by the vagus nerve. The vagus nerve controls our heart rate, controls our respiratory rate. It innervates and guides all of the emission with focus. All of those pass through the ear. As a matter of fact, in traditional East Asian medicine, it is said that all of the yin and yang meridians in the body, i.e., all of the energetic pathways in the body, pass through the ear. So the ear is a crossroads of sorts that is very interesting. It is the only place in the entire body where all of you, your endoderm, your ectoderm, your mesoderm, all of you, that was you when you were first conceived by your parents, small to even be visualized. The ear is the only place where all of those entities, those layers, comprise our brain, our bones, our organs, our viscera. It is the only place where all of those are accessible and still maintain a correspondence of relationship. All of those aspects of your body, mind, even as an adult. And just as exciting as the correspondence within the human body, be identified within the ear, where you can also treat musculoskeletal issues within the ear. Another protocol doesn't focus on that, but it can influence it because the points are not the discrete points, as discrete as the tip of a needle, but they are areas. And all of these areas communicate with it. So again, it is possible to treat the entire body-mind using the auricular or ear points with the protocol. More excitingly, there is also an animal model using the NADA protocol. And I'll just talk about this experiment just very briefly because it's very exciting. It was a rat model and done by a group of researchers at Columbia University in New York, where the animals were divided into two groups. Both groups were made dependent on opiates. A comparison was made between the group that was treated with the NADA protocol. And it may sound amazing, but these same points found on animals such as rats, such as dogs, such as horses. And there's a whole treatment approach entirely into the use of acupuncture and veterinarian medicine. But what was found by these researchers at Columbia and well documented is that use of the NADA protocol not only helped with the signs of withdrawal, increase and mitigate those, but even those the rats that were on the opiates, if they were kept on them, they did not develop tolerance to the same degree, to the same extent. What this says is that, say, even in patients who are receiving opiates, say from their pain medicine doctors, because they need it after surgery or because they have other aspects of pain that they have to live with, that they may be able to stay on the same dose without the need for the escalation in dose because of the development of tolerance. That is huge, especially in the area of opiates, where we're facing an epidemic that is leading the surge in excess here in the United States, both in mental health and in the law enforcement and court systems as well. So individual benefits of NADA protocol can indeed be dramatic. And it appears that the more imbalanced the individual is when the treatment is provided, the more dramatic their response. You'll have access to a paper that I participated in a research study looking at healthcare providers and using this to help with the stress, with COVID stress during, and how to help them to manage this. This was within the second largest healthcare system in the United States, and only VA. What we found is that there was a significant reduction in measures of stress, and we use standardized scales for this, even amongst our healthcare providers, who we know presumably at least have enough money to live on, enough food to eat, they can pay rent, and overall are not the most socioeconomically stressed in our society, but we need to take care of ourselves too. And again, it appears that the more distressed we are, the more distressed the individual is, the more dramatic the effect, similar to the effect that I described that I ever treated over 30 years ago now at the Lincoln Acupuncture Recovery Center. But the effects of NADA we think of as being universal. They are not specific. So I'd like to introduce you to two terms here. One is the idea of transdiagnostic, and the other is the concept of being pansymptomatic. The idea of transdiagnostic comes in that if you look at the DSM-5 and the diagnoses that are used, the idea of anxiety, of impulsivity is so pervasive across all those diagnoses, and it impacts all of them. We know that anxiety and stress makes everything worse, whether it's back pain, whether it's schizophrenia, whether it's trying not to drink too much to self-medicate anxiety or stress in that way. If we can bring down that element of anxiety, everything else is easier to manage, easier to address. And even if pharmaceuticals have to, you can certainly get away with a lower dose, which means less exposure to side effects. And at that dose can expect greater efficacy because your own internal regulatory systems are better balanced. The idea of pan-symptomatic in use of the NADA protocol, we really learned first some decades ago in treating substance use disorder, where the initial focus was on opiates. At the opiate epidemic that was occurring in the 70s into the 80s. Now, of course, we're in a second wave of opiate epidemic, but in that first wave, we started off treating opiate dependence with that focus. We learned from the patients that, hey, they were drinking alcohol too, and it helped with alcohol cravings. We learned that it helped also with crack cocaine. And subsequently down the road, we also were hearing from patients even with prescribed substances such as Valium or Xanax, or even say with antidepressants such as Paxil or Effexor that are notorious for having withdrawal if stopped abruptly. They help mitigate those symptoms too. So the idea of pan-symptomatic really suggests that there's something happening upstream before your body has developed its heart and its lungs, before your body has even developed a well-formulated brain. If you hearken back to the picture of the fetus and my comments about how all of the layers that become us, endoderm, mesoderm, ectoderm in that fetus become us, children, and as adults are already there when we are initially conceived. Something is happening upstream at the NADA protocol through impacting the external ear and thereby connecting with the body, with the brain, that there is an aspect of that connecting with all of that. Now, again, from a neurophysiological perspective, many neurotransmitters have been examined. All of them are impacted through acupuncture, and we believe through use of the NADA protocol as well. There are functional MRI studies. I haven't included those here, but that specifically correlate parts of the brain with parts of the body that are treated with acupuncture or and acupressure. So there's something upstream. But so NADA, the protocol is not specifically targeting anxiety. So our practitioners do not say they're treating anxiety. It does not specifically target impulsivity. Don't say we're treating that. As a matter of fact, our practitioners are trained not to claim to be treating anything specifically. What we are doing is helping the body to balance itself better. Thereby, it acts as an adjunct to any other specific and more targeted treatment that a practitioner, licensed or is supposed to be treating specific illnesses or disorders. It is an adjunct to that. Go better, help to go easier. So, what I'd like to describe is the downstream benefits that this slide depicts. It helps with stress. It helps with the impulsivity. I mentioned that. With trauma. Trauma is everywhere. It's hard to get away from trauma, and we have certainly experienced a lot of that most recently. But again, we learned most poignantly after the World Trade Center was hit in 2001, when our NADA community in New York trained at Lincoln Acupuncture Recovery Center with some of the first folks at ground zero offering treatments. We and the entire mental health profession learned at that time that the idea of pushing patients, clients, communities to verbally articulate trauma before they are ready can be more harmful than helpful. But if you are not able to articulate that, what else do? You can't pass out Xanax and Valium to everybody. That's not appropriate. Even if we could get enough skilled social workers, psychologists, psychiatrists, peer support specialists that had verbal techniques for verbal therapy, what mostly mental health has is verbal therapies. What do you do when folks aren't ready to talk, when they aren't psychologically prepared to be and ready to be able to articulate what you do? Overwhelmingly, those who were offered the NADA protocol versus psychotherapy chose this nonverbal protocol in those early stages. Now, is it saying that that is enough for trauma, that NADA is enough? Perhaps for some it is, but I would not begin to claim that for all. I like to use the example of being hit by a truck. I'm hit by a truck. There's not the time to see a NADA practitioner or an acupuncturist. You want the best Western medicine, pharmaceuticals, our mechanical interventions can afford. But we also know here in the Western world, in the United States, we rank near the bottom when we compare ourselves to other developed countries in terms of lifestyle, in terms of healthcare statistics, chronic disease, and chronic illness. Most of what we treat in mental health, most of what is encountered at that interface of law and mental health involves those sorts of chronic conditions, whether it's chronic exposure to trauma or traumatic communities, where there's illnesses like schizophrenia that are not going to go away, will have to be managed over the course of a lifetime, whether it's other forms of substance use disorder, where we're looking at helping folks with harm reduction, with treatment, also helping them through a maintenance phase, get into a state of wellness. The remarkable thing about NADA protocol is that it can be used across that entire spectrum. Crisis, such as what I described with the impact on New Yorkers when the towers were hit, but also into the idea of wellness, which is where we're using it within healthcare for healthcare practitioners, help to be able to maintain their own sense of balance and wellness in the face of an overwhelming crisis of COVID. As I said, we know that even without much of the similar preparation that medical providers, that often those on the law side of the interface of law and mental health also need that sort of support. And NADA is a tool that can provide that in a consistent, reliable way that will only enhance ability to focus, concentrate, something that benzodiazepines will not do. They can relax, but then you do have to worry about the tolerance. Are they going to be able to concentrate as well? With NADA protocol, you don't have to worry about those things. The use of the acupressure is very simple, easy to do, and through the entire life of NADA, of the use of this technique, there's never been one lawsuit, not one, regarding an adverse event or outcome. Can't be said about anything else that we do in psychiatry. So going back to the downstream benefits, to go through the list, we mentioned stress and impulsivity behaviors that are core to substance use and many behaviors that occur, trauma, harm reduction, and it helps individuals and groups in terms of being more mindfully prepared to benefit from the psychotherapies that are available. So more benefits from the protocol that does not impact specifically patients directly, but indirectly, they certainly do. Even just as importantly, it also speaks to providers and programs. For instance, there is a wealth of literature pointing to the fact that the NADA protocol helps to improve engagement and retention in treatment programs. It is a tool that can help facilitate relapse prevention, well-documented reduction in alcohol and drug cravings, withdrawal symptoms, and it is substance substance neutral, and has been associated, first documented again at the Lincoln Acupuncture Recovery Center, decrease in positive urine tests, increased program completion, improved patient satisfaction, and cost savings. The first HMO study that I ran into was based out of Yonkers, New York, where an HMO had incorporated this, looking at outcomes were found. Easy to incorporate, easy to do. The protocol helps patients, programs, and providers. Now, I will say that the protocol itself, as you've heard me imply, does not only involve the use of the beads or acupressure seeds or gold-plated magnetic seeds. We use those as acupressure devices. There are the needles that are used, which are more highly regulated, and there are different state laws that regulate this. States that do not have favorable NADA laws at this point are really behind the curve. And I would encourage all of our listeners in the audience that have any influence with lawmakers and legislators really push for the consideration of having your state, your jurisdiction, pass laws that are similar to those in I'll use Connecticut as an example, where I got a call, I guess, a couple summers ago, an excited call. Ken, guess what? We've gotten a contract to train in all the mental health centers in Connecticut in the NADA protocol. Those who have contact. That's what you want. It's simple, it's easy, it's inexpensive to do. So even though, treatment is often thought of as an individual sort of a phenomenon, but of course, within psychiatry, the gold standard for decades has been biopsychosocial treatment for clients. But the question is, where is there an operationalization of the concept where we have a single tool that can affect the individual biologically, that can affect psychological state in a favorable way? So either for personal sorts of balancing and driving them toward homeostasis, being better prepared, even to participate in psychotherapies, but also a social tool that can be used in group settings or even in the community and local communities, as was done at the Lincoln Acupuncture Recovery Center, and even before that by the community activists there, the Young Lords and Black Panthers, often spoken about in terms of terms other than their focus on addressing distressing healthcare disparities. Working in a community in the South Bronx at the time that was impoverished, with a hospital that was falling apart, and a drug addiction program, opiates at that time, that was running rampant with no tools that were either directed enough, focused enough, or effective enough to get the job done. They brought this in with great effect. And again, resulting ultimately in developing a protocol that for the first time in the United States has been recognized as a best practice protocol from the alternative complementary medicine side of things, recognized for the first time as a best practice. I like to use the word integrative now as one of the catchwords. Really emphasizes that especially for those who are for our clients who are being treated for various diagnostic conditions, is meant to be integrated with mainstream care, not to be used separately as an alternative, but also speaking to the idea of its use in maintenance and wellness, where we ourselves as practitioners, providers, and programs can incorporate this for better outcomes for ourselves, for our work and job performance, job satisfaction, but also in meeting the metrics that we are bound to meet. Prove that what we are doing in terms of our interventions to prove that they are making a difference also. So as we bring this to a close, I'd like to circle back to our first slide. If you will notice, it's been over 15, 16 years ago since this protocol was recognized as a best practice in substance use and mental health services. I remember as a young psychiatrist then having the honor of participating in being an author for this document and participating in the panel that developed this. How excited I was to be at the cutting edge of a new technique that was very helpful. Just assume that because it got this sort of national recognition through our as a premier organization, getting this sort of information out, identifying these sorts of opportunities that would be that it would be embraced and be everywhere very shortly. What I've learned is that it often can take significant amount of time, even for recognized best practices, roll out as a usual and customary care. And much of my professional life has been devoted to really supporting getting the educational information out with regard to the use of the protocol, to working within healthcare systems in terms of education systems and providers, and my colleagues, both on the medical side and on the acupuncture side about this, working at the interface with law enforcement, especially around issues of the restorative justice movement that is now starting to gain momentum. Looking at both victims as well as victimizers, looking at those within law enforcement and judicial communities that are dealing with these sorts of issues day in and day out and needing help. So really educating there as well, and just trying to increase the education of that. So I really, truly, sincerely hope that this has inspired our attendees to feel a similar passion and fire to try to get this word out and make this wonderful, simple, easy to learn, easy to use tool available to more practitioners, programs, and patients of how we train our NADA practitioners to carry forward the message that it is not them personally or any sort of advanced skill that is needed to use the beads or the needles or the tea that we also advised with regard to the use of the protocol. That is not anything special about them, that it is simply the fact of knowing how to impact your own body with techniques, where to push in order to get the sort of response that you're looking for. I did not begin by mentioning that I'm current president of the National Acupuncture Association, but I am. And I invite anyone who wants to know more to look at the links and articles, information associated with this presentation. You will find a website for the organization that will take you to many more resources. We have a national office. Please feel free to call, send in any sorts of inquiries. We're happy to respond and having a wonderful office staff as well. And I would encourage you to consider joining the organization. We have organizational, a membership that is organizational. We started that a few years ago. We have membership for individuals that can, as an associate, so you don't have to even be a practitioner, still join and support. And I'd encourage all of you to consider getting trained. We have a system of registered trainers that have been vetted and approved by the organization, that are distributed around the country, around the world, and would be happy to hear from you, and to hear about your interests, helping us to bring us into your own situations and communities and programs. Thank you very much.